We have a very interesting lecturer today who also happens to be related to my faculty member, Dr. Nina Vazavada. So I'm pleased to introduce to you Dr. Kenar Jhaveri. He got his doctorate degree at Syracuse and did his internal medicine at Yale and his nephrology fellowship at the Weill Cornell Medical College in New York. He is currently at the Hofstra Medical Center, where he is the associate director associate division chief for kidney diseases and hypertension. He is the director of onconephrology there, and has also been a Twitter mate of mine for the last several years. He is one of the individuals in nephrology who has taken the lead in using social media as a means for bringing groups together for medical education purposes, as well as mutual commiseration. And so it is my great honor and pleasure to introduce him to talk to us today about his own journey in using social media.
Thank you. So, good morning, everybody. It's my first time in Louisville, and it's my honor to be here. Dr. Lederer, thank you for having me here. So my story today, I'm not going to give a traditional lecture. I will try to walk around a little bit, and I'm not going to use that much social media tools, counter to what I'm talking about. And I just want you to focus on how social media can help you. And I understand just maybe a month ago, you had a talk on pitfalls of social media by a lawyer. So I'll try to do the exact opposite and give you the positive side of social media and how it's changed my life as a teacher, as a clinician, and even as just an individual. So hopefully this will inspire even one of you to make a positive change in your life. I would love that. So unfortunately, we live in a world where people are skeptics, and everything that started, even from a stethoscope use, was challenged. The first time this was used, people challenged it and said, no one's going to ever use this again. This is, no, what do you mean by listening to the heart? And now we know this is the symbol of medicine. And so you should try to embrace things as it comes and never really challenge. You have to challenge things, but take it with some help that it might actually help you in some part of life. So what I'm going to start today first is talk about two sets of people. And these two sets of people actually change the world we live in for medicine and then also parts of social media. So the first person, can anyone recognize who that is? So this actually is Cecil, the writer for one of the first textbooks of internal medicine. And this textbook was in the 1930s to 1960s, very popular in most medical schools. And it was a very smart idea by Cecil that he actually selected the authors of this textbook based on different medical schools around the country. So which medical school would not want Cecil's textbook? There was already a faculty member part of the textbook. It was a very good, smart idea. The textbook is based basically by disease. So MI, you read about MI, good. But the problem was someone came in with headache. You didn't know where to go in the textbook because they could be presenting still with a stroke or they could be presenting with an alternate disease. You didn't know where to go. There comes Harrison. And I'm hoping that most residents here actually have looked at Harrison, but my guess is probably not. But most of us who actually trained before the 1990s and even before maybe 2000 actually looked at Harrison's textbook and how it looks like. And it goes by diagnoses. And then it goes by symptoms, and then you try to figure out the diagnosis, okay? And that book became then quickly replacing Cecil. It was more practical. You actually had a patient present with symptoms. You went back and looked into the diagnosis. And this is by far the best textbook internal medicine ever produced. And so far, nothing has replaced in a textbook version of Harrison, okay? then we enter the world of technology. And Steve Jobs changed our world by bringing in the iPhone and the Apple computer. And this has really revolutionized technology. It was not meant for medicine. It was done for other reasons, but I'll bring in these folks to introduce you to how they might have changed things. And that's what everyone knows Bill Gates and how that actually changed technology. That's Dorsey. He's the one who invented Twitter. And again, not intended for medicine and education, but it was all kind of share information. People were texting, it's sort of short texting, but to the world. And then everyone knows the controversial Mark Zuckerberg with Facebook as the next big thing, that wave that came around with social media. And finally, the developers of Google that changes the way we search strategies today. But let me tell you my first story. Today is just going to be stories. The first story begins in Harvard in 1990. And a young, at that time, nephrologist, everything good starts with a nephrologist, okay? So a young nephrologist at Harvard had written a big textbook on different topics in nephrology and got it published. At that time, CD-ROMs were a big thing. And one of his good friends was in the technology industry and said, why don't you put this textbook of nephrology in a CD-ROM and just give it out to people? People have computers. They put it in. It's so much better than actually going around and selling your book. That's a brilliant idea. And then came around the World Wide Web. He said, forget the CD-ROM. Let's put it on the web. And this is what we call today UpToDate. That's how UpToDate was born. It was born as a nephrology section first and then grew into medicine. And it was started by Bud Rose. That's what he calls himself. And that's the beginning of UpToDate, which you know now, every resident here knows UpToDate more than Harrison's, right? So UpToDate has really replaced, in my opinion, the textbook of medicine. And it is the most up-to-date medicine right now, textbook of medicine currently. And it was all born in that one room in his basement when he wanted to change the way he presented nephrology to the world. So that's the beginning of UpToDate. And this is the time where the first time technology really merged with medicine and things were evolving as people were looking at medicine in a different way, that there was something that we could actually see happening on a daily basis updated. And we could actually make those changes on a real-time basis and provide that information to people. So right now, I can tell you, we live in a world of social media. We live in a world of technology. It's good to embrace it. You cannot ignore it. You have to know the pitfalls. You need the positive things of technology. You cannot just be, oh, I'm not going to be on Facebook. I'm not going to be Googling. I'm not going to be Twitter. It's good to know where your students are. It's good to know where your residents are. It's good to know where your patients are, because that will actually tell you a lot about the disease state. It might teach you a lot that you might have not learned otherwise. So my first story, a second story, is something even bigger. This actually is, I'm going to tell you, this is a big academic center. It's a large academic center. In 2005 is the year. A distinguished young, actually at that time, a fellow in allergy immunology is presenting a case to a visiting professor of rheumatology. And the case is of an infant with diarrhea, an unusual rash like an alligator skin, multiple immunological abnormalities, low T cell function, and tissue eosinophilia. And there was peripheral eosinophilia, and there was an X-linked genetic trait in the patient's family. And of course, when you have a case conference like this, the attending and the residents and fellows all sit around, trying to come up with a differential diagnosis, and that went around. And finally, the visiting professor asked the student, asked the fellow, what is your final diagnosis? And she looked up, thought for a while, and said, I think this patient has IPEX syndrome. And everyone's like, what is IPEX syndrome? Well, it is immunodeficiency, polyendocrineopathy, enteropathy, X-linked. It's a FOXP3 mutation in low T cells, regulatory cells. And they said, well, that fits. The patient had everything that was related to IPEX syndrome. It fit the diagnosis. Let's go with that. 2-3 weeks later, genetic testing confirmed FOXP3 mutation. It was IPEX syndrome. And then the visiting professor went back, said, how did you figure that out? No one in the room, none of these distinguished professors could figure this out. Well, I took all the diagnosis the patient had, the X-linked, all those things, the genetic mutation, and I just put it on Google. And the first thing that popped up was IPEX syndrome. And the professor was like, what? You Googled it? And she said, yeah. The place was actually my home institution, UofL Health, at that time called Long Island Jewish Medical Center. And this case was then published as a diagnostic case was performed by the professor, who was Dr. Greenwald, the prior ex-chief of rheumatology at North Shore LIJ. And this is the first time someone had written about someone diagnosing someone through Google by Googling the diagnosis. And if you don't believe it, Google it. It's there. It's in the New England Journal. So this is interesting. And when I read this, I'm like, wow, this is fascinating. And that someone actually could come up with a diagnosis through Google. So I went back while preparing for this talk and actually, Dr. Greenwald is retired. So I actually gave him a call. He still lives in the community, and to ask him what he thought of what's going on right now. But what he had written in the paper, I want to read. Where does this lead us? Are we physicians no longer needed? Is an observer who can accurately select the findings to be entered in a Google search all we need for a diagnosis to appear, as if by magic? Surely this is a trend to watch. This was 2005. And he said, well, at that time, we didn't know where Google was taking us, but at this point, Google has really taken over. And he thought, in the retired state, that Google has superseded PubMed when I spoke with him. And so what I want to tell you is, please, 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 you should not be, this is not to show that Google should be replacing your MD degree. And patients are doing this. So I want you to, this is an exercise that you should be doing it so you know what your patients are actually looking at. When they Google their diagnosis and they come back with you and tell you, hey, I thought I had this syndrome. It's FSGS, and FSGS is bad. 60% of African Americans have it. And you have to know what they're reading out there on Google. So we actually did a small study at our institution many years ago where we actually started to study this heuristic model of reasoning, where we actually go through a differential diagnosis and experience and compare it to Googling. So we asked our internal medicine residents, and we came up with a list of renal diagnosis, so IgA nephropathy, diabetic nephropathy, and some rare stuff, some common stuff. And we gave them some search terms. So if someone presented with a young 5-year-old presented with nephrotic syndrome, most people will say minimal change disease from experience. If a 25-year-old presented with hematuria, most people will say IgA nephropathy from experience. But if we put those search terms into Google, what do you get? We don't know. So we asked the residents to Google it, the search. Then we also asked our fellows to speak from experience and attendings with the various degrees of experience. And we found that by far experience won, thank God. But the residents got very close to the fellows, statistically significant level to fellows training in terms of Googling the diagnosis. Interestingly, for common diseases, they failed. Google failed. For rare diseases, it actually did better than the fellows. Okay, so should you be using Google? I leave it for your discretion. But sometimes when you're stumped in a tough case and all your experience has been completely exhausted, you asked your faculty colleagues, you've asked around the country, no one knows what's exactly going on, you're not sure. It's not a bad idea to Google. Sometimes you will be surprised. You might come up with a diagnosis, but not even that. It might give you some clues to what else maybe you're missing and you might have not thought about. Okay? Have I used Google sometimes? Yes, sometimes. It's not my primary source for a diagnostic dilemma, but it has been sometimes a very useful aid when I have to look for something that I think it might be rare, I'm missing in my differential diagnosis and exhausted my other common thoughts of what this patient might be having or going through, and especially even treatment purposes. Some of the papers are not on PubMed, and there's open access journals that you might be not be able to access. through PubMed, and you'll still get to Google Scholar or Google. So again, I just wanted to give you that story because it actually can be useful in certain cases. So the next thing I want to tell you is a story about another individual named the late Nate Hellman. So it was 2009. I had just finished my fellowship, and during my fellowship, I used to go on to what they call a blog, written by the late Nate Nathaniel Hellman, called the Renal Fellow Network. And it actually was started by him at Harvard. And it was basically him, he would see interesting cases, he would just write about the disease. So if he saw a case about IgA nephropathy, he would write a summary of IgA nephropathy just in short, maybe less than 100 words, like basically an attention span of most of our learners these days. So not a textbook, not a chapter on up to date, but just a short snippet take-home point on IgA nephropathy. Slowly, in 3-4 years, it turned out that Renal Fellow Network was becoming so popular that everyone around the world was using it. And it was run by a fellow. There was no much editing there. It was actually a very well done blog. And a lot of people had vetted it, from National Kidney Foundation to ASN. Nate passed away in 2009 from autosomal polycystic kidney disease and a brain aneurysm. And since then, some of us who are active in the social media field kind of took over some of the work that he was doing and really have made nephrology social media sort of what he began to the next level. So as an attending in 2009, I said, why can't we have an attending directed academic blog? And I started something called Nephron Power, probably one of the first academic blogs in nephrology. And I would do exactly what Nate used to do. Well, if I learned something that day, if I read something, I would write about it. Okay? It was my learning and teaching diary. If I went to a lecture on medicine grand rounds or renal grand rounds, and I took a summary notes, instead of it being in a notebook, it was on my blog. And I would put links to articles that were useful, and it was just not more than 300 words, not more than 200 words, a succinct summary. And this is what a blog is. Very easy to do. I went to blogger.com. It's a free website, and they give you a template. All you have to do is type and put a picture up, and you're done. So I'm not kidding. It's very easy. So it's easy to start a blog. I call it Nephron Power. You can call it Brain Drain, HomeKit blog, call it, My Heart, whatever you want to. It is totally doable and very easy to start. So, but everyone was, in the academic world was like, what are you doing? You should be writing papers. You need to get your name published. Writing a blog is not going to get you anywhere just because you wrote about some esoteric disease you saw, or, it's not really going to get you anywhere academically. Well, I said, but it helps people. It was actually a very good educational tool. There was a lot of usage of these type of blogs. There was another one called Precious Body Fluids, written by another nephrologist. And so there were a lot of these blogs coming around at that time. So what we decided to do then is also, if we enter a conference, so if there's a conference of the American Society of Nephrology, or for example, ACC, or a general medicine conference, we would blog about the talks at the conference so that people who couldn't make it could actually be able to learn about what they missed at the conference, the highlights, of course with permission from the actual organization. And this is what got us to the next level, because now we were using blogs to disseminate new information that was not being disseminated in a timely fashion. It was happening in real time, and quickly the organizations learned that they should be doing this. Why are these solo bloggers doing it? And that's how sort of online sort of blogging, news reporting of articles started happening in around 2009, 2010. So we finally published about that. So, that's what the other academics like, right? You should publish what you do. You should be doing that. Even if it's descriptive, you should publish a novelty, that thing you're doing. So we did that. And that is actually so this is an example of Nephron Power, collapsing FSGS and TMA, and we have different topics that, we kind of talk about. But then we have to keep convincing the academia that, okay, no, this is not going to work. If the stethoscope doesn't work, it doesn't work. You can't pick up stuff. It's not useful. So it's 2010, and to move it to the next level, I think if you have a backing of an organization when you're blogging, it really makes the reader, oh, this is actually valuable. Up to date, when it first started, was not valuable. People probably questioned it. They probably like, it's a solo person. When it became an organization and vetted by a lot of institutions, it becomes something that you were like, wow, I actually will use this. So the first journal to actually embrace blogging in the nephrology world was American Journal of Kidney Diseases. And at that time, when this was happening, neither the New England Journal, JAMA, or any of the top medicine had a blog. So Andrew Levy, the editor-in-chief, had a good vision. He actually had invited me and a couple of our colleagues up to Boston and said, I have a proposition for you. And my sister lives there, and she's like, okay, I said, I'm going to come over. It was, one winter morning, and she was like, why are you here? I was like, oh, I'm meeting the editor-in-chief of AJKD, and they want me to start a blog. And she started laughing. She's like, you want to start a blog for a journal? Like, yeah, a blog for a journal. I was like, who does that? And I was like, no, this is the new thing. You have to have blogs for journals. What are you going to do in the blog? Like, I don't know. We're going to figure it out. But it's going to be educational. It's going to be not what's in the journal and more interactive. And that's exactly what we did. 8 years later, this is the only renal journal still to have a blog that's very highly functional with quizzes, educational activities that supplement the actual journal article. And we select articles, there are interviews, there are quizzes, anagrams, puzzles, video interviews, corollary papers related to that, and also news reporting of actual conferences. So now we have the academia vetting this because it's now backed up by a journal. There was a good editing process as well, where we had a whole team that was led by the advisory board and then blog contributors, and part of them were the editorial board. So we actually can have editing going on part of the whole process. So not everything could be, in a personal blog might be accurate. You might be reading this as a blog, it's not up to date. It might not be 100%, and some of them are personal views, some are accurate or inaccurate information, but academic blog backed up by a journal has much more value in academia. And of course, we wrote about this too, so to convince the academia. So it actually is, I did this for 5 to 6 years. Now it's led by another person, and it's still running with a good number of views and a good impact. So now it's turned the other way around, where authors are asking us, "Are you going to blog about our paper, please?" So we're thinking you should be considering blog factor these days as opposed to impact factor in some of the journals. So if you get blogged about or Googled, you probably have a better chance of your paper being cited, maybe. Not sure about that, but something to look into. So that's the whole blogging thing. So the next story I'm going to tell you is about Twitter. And Twitter is by far probably the best educational tool you'll come around for medicine. Okay, Facebook, I have an account, it's personal use. I wouldn't recommend it for educational purposes. There's a lot of other chatter on there, but Twitter is very, very interesting. So Twitter is like having group texting. Okay, so you have a certain amount of characters you're allowed, and you can text to the world or to your followers or to your community important educational information. The key is, certain things you should be aware of Twitter. So Twitter is really like creating your network. Okay, so if you are on Twitter and you want to follow what you want to really learn, that's the type of people you follow. So I would follow Dr. Lederer. I would follow the American Society of Nephrology. I would follow the Journal of American Society of Nephrology. I would follow the people I want to follow, that I want to create my community of nephrology or medicine. It could be cardiology, it could be pulmonary, whatever you want to create. And these people you're friends with or you're following are either experts in the field of what you're interested in or some sort of corollary to that. Okay, if you want to follow sports and other political stuff, that's a different account. But if you want to do this for strictly educational purposes, those are the people you follow. Limit the people you follow, otherwise you're going to get a lot of tweets every day. Okay, so limit to a certain amount of group of people that you really feel have valuable educational material, and that you learn as you know who you're following. You can always unfollow them if you don't feel it's important. What that creates for you is a community, a network, and it's basically my faculty lounge. It's my friends and faculty that I might have met at conferences. I might have, seen their talk, and I think, this is the person I'm going to follow on Twitter because they have educational value. When they tweet, they have good articles they tweet. They tweet important information. So that is the value of Twitter when you actually create the right network and you actually can get all the information about that. And that creating the network is like the faculty lounge. You can ask them questions and they'll tell you potential their experiences. So another story, I'm rounding on one of the floors and we have a case that really stunned everybody. It was a case of severe hyponatremia, low sodium levels, and actually was correcting very fast. But at the same time, the patient was developing rhabdomyolysis and the CPKs were rising. And we were like in the hospital, so we're not giving this patient anything. So is there a relationship in correction of hyponatremia or to rhabdo? Or is there a relationship with hyponatremia in general to create rhabdo? I had never heard of that. And so I quickly tweeted that question to my followers while I'm rounding, because going through PubMed takes a little bit longer, but quickly sending a quick tweet. And within 5 minutes, I had 17 references tweeted to me and experiences on why it's related. And I could just give that out back on rounds within 10 minutes. I just had CME done for my day. I had, graduate medical education done for my residents, and even the medical students learned, and the patient also. So this was within 15 minutes of me tweeting. I had the responses back because I had the right network. I had the right people I was following. It was my. I just entered that faculty lounge. Hey, have you seen this? Yes, this is the reference 5. This is from this. This is from this article. Here's my experience. I've seen 7 cases of this. This is why it happens. Wow. From London to people from Australia, from India, all around the world. These are nephrologists or critical care doctors who were tweeting their responses. I wouldn't have found that on PubMed in 5 minutes, guaranteed. I would be searching, and then I have to download the article. These are PDFs sent to me through Twitter. I have at least a snapshot. I have a summary written by somebody on a blog, tweeted to me. Brilliant. I was just like stunned by the usefulness of Twitter. Now I use it on a regular basis. If I have a difficult question, I just tweet it out and I get responses within 5 minutes, even seconds sometimes. Because with a different zone in the country and different part of the world, they might be awake and looking at this stuff, and they have the experience. So very, very, very useful. The other place where it's very useful is it's my morning newspaper for academia. So I don't need to get journals delivered to my home. It gets delivered to Twitter. So if I'm following Jason, if I'm following C. Jason, AJKD, for example, you could be following Jack, you could be following, cancer journals, you could be following medicine journals, and the articles get tweeted. So you know what article is important to you, it's coming in this journal. Most articles now are tweeted by the main journals. And where it's very useful is actually you following journals of other specialties. So normally you, as a nephrologist, why would I be subscribing to Jack? I wouldn't. Why would I be subscribing to a rheumatology journal? I wouldn't. But Twitter allows me to get those articles because it has a nephrology twist to it, and someone is following it, and I'm following that person. I get it on my account. So one day I got tweeted a Jack article by somebody that had to do with cardiorenal syndrome, but it didn't come in a nephrology journal. I would have never seen that article. It wasn't for Twitter or someone sharing that to me on Twitter. So it really expands your horizon of actually using and getting articles and information outside the scope of specialty. Medicine, general medicine journals and your specialty journals, it's very easy to get to paper. But it's when you go outside, and a lot of good articles about your specialty are published in other journals. I do a lot of onconephrology. A lot of the good articles are in cancer journals. I'm missing a lot of those because they're not in my nephrology journal. So Twitter allows me to get those because I'm following the right people. I might be following some oncologists that I want to know because they will then send me those articles. or they will tweet about it. So that's where the whole, networking of Twitter is very useful. And then the other thing is, who doesn't want to promote themselves, right? A lot of these journals will tweet their articles. They want to promote their journal, but they also want to promote the author, and the authors love that. Which author doesn't like to be Googled, blogged, or tweeted about? So a lot of the journals do these now. They will actually send you a letter. Your manuscript is accepted. Please send me your Twitter handle so we can tweet it. And then they will take a snapshot of the paper, and then they will do this. They will actually put their logo. They will tweet. So your article just gets tweeted along with you as the author, and now your work gets tweeted out to the rest of the world. So this is sort of what I call the tweet factor. So we have the blog factor, the tweet factor, and who knows, are these better than impact factors these days? So we're not sure. So this is my next story will take you to the final stretch of how social media can really take off. So these are two of my good friends. One is Joel Tolf, and he's in Detroit, a very well-known nephrologist in private practice, but really, really does academia as his passion. He educates day in and day out. He's manic about education. He's awesome. Okay, he actually won the Educator Award of ASN last year. Then there's Matt Sparks. He's another big-time educator in social media and medical education in nephrology at Duke. He's the associate program director there. So I met these guys through social media, and we had common themes of teaching through social media and nephrology, and we became friends. And they were part of my team when we started the AJKD blog, and I tried to recruit everybody who was in nephrology and social media so no other journal could take them. So they were actually part of our team and a very integral part of the team. And one of the things they came up with was Kenar. It was 2013, December or so. They're like, why don't we do a game as part of the blog for the journal? And they said, we'll do something called Neph Madness. And I was very puzzled because I grew up in the world of Asian sports like cricket and soccer, which is the real football. The American football is not really called, this is the real football. And they're like, there's something called March Madness. And I'm like, what the heck is that? It's, December, it's cold, and what are you talking about March Madness? And they said, well, you haven't heard of March Madness? You've been in America for so many years. Get off the boat already. And I was like, so teach me. So they taught me what March Madness was, and it was brilliant. Now we're going to make this concept a nephrology game, and instead of doing teams of players and fighting against each other, we're going to create concepts in nephrology fighting each other. And we have done this now for 6 years, and this is each year's logos. Of course, there's a basketball in each one of them, right? This is Dept 2014, 15, and 16. And this is the most recent one, 2018, Neph Madness. I think this is the best one so far. So just like what you thought, it's 32 brackets, topics fighting each other. So for example, there's a cardiorenal region, and there's certain trials fighting it out, called VAPTAN versus Paradigm trial in heart failure. Here there's nutrition fighting it out. There's genetics, infection, vascular oncology, nephron-sparing surgery, which is nephrectomy for renal cancer. And each one of these is a link that takes you to a blog post that you read about. You can even get CME credit about. And then you pick your winner, and you move down each and submit your brackets. And we have a blue ribbon panel and other things who decide the final winners, and everyone gets surprised who gets to the closest, just the way it works. So it actually creates a lot of learning, and it stays permanent each year, and actually creates blogs to be more useful. And then people tweet about each one of these. They're like fighting. They're like, no, I want this one to win because I feel this is the right way to do things. There's a lot of people debating about it online and a lot of community building. And each year we have more and more, almost double, triple, quadruple the number of participants, including top-tier nephrologists, ASN presidents doing it, ex-ASN presidents doing it, and people competing against each other, not calling each other names yet. But it's actually a lot of fun. And probably the only game, to my knowledge, in internal medicine that is to this level, using all forms of social media to its fullest extent. Okay? And this really has revolutionized the way we teach in nephrology. Every year, the residents, fellows, attendings wait for Neph Madness. It takes almost 4 months to create the material because we actually have to get accurate information, put all that information in there, readable context, and actually do it. How we did it for fellows this year is in my institution, we would sit down and we assigned each fellow a section. So if you have 8 fellows, 10 fellows, whatever it is, and attending as well. And they would come prepared to tell us why they think each one should move to the next round and kind of educate everybody for 10 minutes on each topic. And this way, everyone learned in a lunch setting, and we finally came up with our championship winner as part of the division and submitted our brackets. So it also improves your internal camaraderie. It improves education internally while you're doing the whole thing nationally. Internationally, the winners have been actually from all over the world, from Australia, India, so forth. It's a lot of fun. You can still check it out on AJKD blog. They're all still there. You can see how it looks, and these how each region and each one then goes into details. And these are sort of the rules. This year we only did 32 concepts and CME credit, and you make your picks, register for bracket, and then cheer your brackets, bash your friends, whatever you want to do. And there's also prizes. It is making education fun. At the same time, you're learning. You're even getting CME credit. It can't get better than this. I'm sure it does. And then finally, what else does it did to me was create friends and friends' friends. Matt and I have become friends now for so many years through social media. That's my kids and Matt's kids now hang out together. Every time we go to North Carolina, we hang out. When he comes to New York, we hang out. So I've created friendships that are lasting lifelong because of social media and people I met through social media. So it's something else on a personal level that also is improved reliance because of social media. So, at the end, I just want to say that this is all good, it's all happy and fun, but medicine is not just about social media, right? Medicine is about humanity. You have to see the patient. You have to touch the patient. You have to feel the patient. You have to know medicine through experience. You have to still diagnose Wegener's or polyangiitis, microscopic, through a clinical diagnosis. You have to see, hear, feel, touch. That cannot be replaced in medicine, and no one should replace that. No one can replace the stethoscope. No one can replace your hand-holding and the humanity that medicine has to offer. But what social media does is adds to your experience. It makes you a better educator. It completes your experience. It actually will give you help to help diagnose. It will aid you to understand your patient better in the 21st century because your patients are going out there and doing these things. It will tell you what the patient might be, learning online. Use it as your aid. Use it to help educate the patient. Use it to help educate yourself and your peers and your students. Keep your patient's life confidential, but at the same time, use social media to help you help your patient, not to do anything harmful to your patient. So I think social media is here to stay, and it's not going to go away. So you have to embrace it with some degree of how it can help you. I'd just like to thank my division because it can't be possible because I have such a great division that allows us to do creative things, and that's thanks to our chief, Dr. Fishbane. And these are some of my fellows who actually initially were like, what are you doing? Why using Twitter and things? But now they realize this is the way the world is, and they really embrace a lot of these things we do in our division. And we have a division Twitter account. We tweet about interesting articles. They tweet back. We actually share good pictures, memories. It becomes something permanent that they will love. And this is my family, my kids, my parents, my wife. And I just want to end with this video that I think is very important for you to see. Thank you. Take questions.
Thanks, Kenar. So my favorite fight about regulation of electrolytes starts never gone on enough matter. So a couple of Twitter tools that you didn't mention. One of them is for nephrology. It's called Nephrology, right? It's a journal club that plays
Correct.
1 day a week articles together.
Yes, so there's something called Nephrology Journal Club, or NephJC, which is a Twitter handle, and started by Joel and Swapnil, two nephrologists that meets every 2 weeks, and there's an article selected, and nephrologists around the world actually come and actually give um, topic discussions on it. There's actually a systematic way of doing it. They start with the introduction, methods, and results, and there's a discussion. And the best part is the author is invited. So he actually completes the entire circle of like, oh, I don't know why they use these methods. That's kind of dumb. You say things like that in the journal club. But like, no, you can't say that anymore because the author is there. And actually, the author's perspective is probably the most important perspective to have. So having one of the authors there is key. and the journal club runs every 2 weeks, 9 to 10 on a Tuesday, is again a part of this whole thing that we created together as the community. And it's very important. What I think is I learned from this collaboration, and I think it's just how we do good research comes out of collaboration with multiple institutions. The same way good social media education tools come through collaboration. And none of this could have been possible without the right people collaborating and making it work, and good support from institutions like ASN and the National Kidney Foundation. Yes, so there are. Yes, so there are certain studies that have looked into this, like smoking cessation. There's stuff on, certain other pediatric literature. There is where certain things that reach people faster, social media. The one big one in nephrology is transplant and getting transplant referrals and things through social media dissemination for patients has been increased. There's one paper that showed that, and there's one paper in cardiology that showed the opposite, that actually did not help, in terms of educating and disseminating information. So there is still ongoing research in that, and people have to figure out the right way to do the metrics in social media, and there's still debate on how to use a number of tweets, likes, because you could actually just like something and never read it. You could just press the like, doesn't mean you read it. Or you can retweet something, but it's like you actually never clicked on that and read the paper. So we don't know exactly what people are doing behind that computer scene. So that's the hard part, the challenge. Yeah, so that's a very good question, because you are going to follow the likes of your mind, and that's what you're trying to get at. So not through Twitter, it's very hard to do that because they're not going to follow the opposite side. But if you have a patient in your room and they tell you, I Googled this, you should ask, did you Google it? Where did you find that information? And actually have them show you the sites. And then I usually counter that with a more sort of site that has more value. So a lot of times the Google they get is a patient venting about a side effect they've had. Okay, and that's not really a valuable site because it's a rare side effect and so forth. So I actually give them the website of the National Kidney Foundation, show it in my office to them, like, hey, this is a more valuable resource. You should talk to these patients. They've gone through this. These are the negative side effects, the positive things about it. It might take some time because some people, we are living in a world where people follow the people they want to follow. But it's a new challenge that we have to learn to face. But I think that's an important question to ask every visit. Do you use Google? And how do you know, what do you read about what your diagnosis? And you'll be surprised. Don't assume the 90-year-old doesn't know how to do it. Okay, there are a lot of people, I wouldn't go by age. So you should not discriminate. Just because they're young versus old is not how they just, you should be doing that. Ask every patient and every language and every culture. People are using social media. Yeah. So I'll go to the second one first because my strict rule is not to disclose or offer medical advice on Twitter directly to a patient. And if they keep asking, I say you should, call your doctor, and you can unfollow them. Okay. But in general rule for any social media thing, and I think you had a talk about this a few months ago, is to not offer medical advice. A general advice of medicine is what your blogs or talk about is fine. And most blogs will have a disclaimer at the bottom that you should still go to your physician, personal advice on what your disease state is. And try not to follow or tweet your patient. There are certain physicians who treat and have conversations on Twitter with their patient. I strictly discourage that. There are certain ethics of social media that you should follow, and one of that is never interact with your customer. In our case, as a patient. In this case, it's still different than a customer for Kmart or the bank. But we are dealing with patient lives at stake, and you don't want to be. This is becomes a part of the medical chart then, technically. So anything that you put on social media with a patient conversation is retrievable by law and can be used against or for you. So I would just be careful of putting patient stuff out there. Hecklers, it could be physicians versus, we've had a few of those. And personally, the way I deal with this is, I just you give back a very neutral statement and kind of let it be. And eventually they stop. But some people just unfollow them. You just unfollow them. There are these medium Twitter wars going on Twitter about certain concepts. Sometimes some of this is good because you want to have that dialogue. And there are times where if you know the person, I pick up the phone and talk with them. Like, that's not the way you behave on social media, or you want to have that in a nice way, a conversation about, this is not right. Or maybe you didn't understand their tone because when you text or tweet, you don't know what tone they're talking in. And picking up the phone might be more useful, or emailing them. So it's something that we are all working towards. It's very hard, challenging sometimes because there are very strong-minded people that will tweet things that are inappropriate. Oh.
To our community of followers, while you were talking. So for all of our visiting professors, send you home with
Oh, wow.
name, Kenar Jhaveri, Medicine Grand Rounds, University of Louisville.
Oh, thank you so much.
For a fabulous Grand Rounds.
Thank you. Thank you. Oh, this is great. Thank you so much.
Now, we will mail that to you.
Yeah, they'll kick me out.
So the woman there that just asked you about the hecklers.
Yeah.
Jason.
So I give
your cameraman?
Oh. Take a picture with you.
Uh-huh. Well, it looks like you're. Hey, Nina. Nina. Pretty nice.